Before you have surgery, it is essential to follow certain steps. These steps ensure your procedure and recovery will be as successful as possible. For instance, you will need to have a preoperative assessment.
Sign in right here, and then we'll have a seat and she's going to call your name.
This is to ensure you are able to undergo surgery. Most likely, your surgeon will have arranged for advanced imaging studies, lung function tests, a cardiac stress test, as well as blood tests, and will have reviewed the results.
It takes a lot of time, just like we've seen today.
Then there's going to be a lot of downtime while you're waiting to get things done.
You have to have patience.
The tests help identify your current pulmonary or lung function, the extent of your tumor, and your overall state of health. A blood test, urinalysis, and chest X-ray are routine tests before your operation. If you have any heart condition or are over the age of 50, you may also need an electrocardiogram. A pulmonary function measures the amount of air that you breathe in and how much oxygen gets into your bloodstream. You usually don't eat or smoke for 4 to 6 hours before the test. Also, a heart ultrasound may be performed.
In terms of the cancer, we need to find out whether it's spread anywhere. That's called staging. We do that with a couple of tests. You've already had your CAT scan. This tells me that the spot's here in your left upper lobe. Now we're going to do a PET scan, which is a metabolic test. It'll tell me which cells in your body are metabolically active. I expect this spot in your upper lobe to light up. What I'd like to find out is if there are any lymph nodes here in the middle part of your chest that might be involved, and any sites outside your chest that might be involved.
A CT scan and possibly a PET whole body scan or MRI of the brain may be needed.
All these things are non-invasive. They just involve you holding still and letting us take some pictures. The next step we would get to is a trip to the operating room. First thing I'm going to do is look down the windpipe with a small scope. This scope would go down your windpipe and out into the lung and allow me to look at the anatomy of the lung. And occasionally I can get all the way out to this tumor and take some samples.
This clinic visit is also the time to start thinking about your postoperative care. He would come to the recovery room afterwards and be in there for an hour or two. After hospitalization for surgery, most patients are able to be discharged and return home within a few days. However, some patients have special needs. They may require additional rehabilitation after surgery and a longer stay in the hospital, or they may need assistance with therapy when they return home. At the time of your clinic visit, you may be identified as someone eligible to participate in research studies.
I'm with the thoracic research team here.
Participation in these trials may allow you access to newer experimental treatments. How can that help you or help other people? We like to keep that tissue available to study that. You know, they'll never know that it's your tissue and so forth like that. But what that does, and you know, you don't have to be involved in that unless you want to. But a lot of people say, well, I don't need that tissue anymore, and I'm glad you to have it.
We just covered some of the preoperative tests and procedures. Now let's review what you can do at home. When possible, you should start preparing 3 to 5 weeks before your operation. Refer to your lung surgery booklet, including the sheets on the front cover.
Absolutely stop smoking is probably one of the most important things.
The best thing you can do to make this surgical intervention safe is to quit smoking. Can you do that for me?
Yes.
Okay.
I'm starting some stages of it now.
Okay, well, there's lots of tools to help, and we can use combinations of those, but it starts with you.
Your breathing exercises are extremely important and will remain so throughout your hospitalization. You are to do them on a regular basis after your surgery and as you recuperate at home.
So this is the incentive spirometer. The first step is to just sit up straight in your chair.
Okay.
Great. And then you're going to exhale. Okay, so just breathe out like you normally would. Then you're going to take the incentive spirometer, you're going to put this in your mouth, close your lips around it, and breathe in deeply. Hold. Okay.
4 or 5 times every hour, you will take deep breaths to help expand your lungs. You may be also given a flutter valve. Blowing into this 4 or 5 times an hour will help you clear secretions. This device may make you cough to help clear mucus from your airways. Doing your breathing exercises is one way your participation is important in your recovery from surgery.
Before your operation, Begin or continue with a daily exercise plan. Make sure this is okay with your doctor. Start by walking or riding a stationary bike. You want to exercise for 30 minutes each day. It's okay if you have to rest after 10 minutes or so. Just get up and go 2 more times later. While in the hospital, you will usually start walking the day after your operation.
After your operation, you might have some stiffness and pain. So I'm going to teach you some range of motion exercises. First of all, we're just going to teach you how to do some range of motion with your head and neck. You're going to go side to side, so put your ear almost to your shoulder. Great. Then this side. All right, wonderful. Lift your arms straight up and just go slow. And you're going to repeat that 5 to 6 times. Just take your hands and go and walk up the wall.
Some of your medications may have to be adjusted before your operation. Write down a list of all the medications and share this with your doctor. Your list should include medications that are prescribed by other doctors and even over-the-counter medications, such as aspirin, herbs, and vitamins. Refer to the booklet for a full list of medications.